Hi, everyone. This is Dr. Wardwell. I'm one of the general practice veterinarians and a soft tissue surgeon here at Viking Veterinary Hospital in Nampa, Idaho, U.S. Uh, Today we have a pretty interesting case here. This is a dog that had a sudden swelling in its hind limb in the thigh, and it was referred to me because there was concern that it was a large tumor wrapping around the leg. What it actually ended up being is what's called an intermuscular lipoma. So it's a benign tumor, so not cancerous, and it's located in between two of the muscles in the back of the thigh. So these tumors are pretty easy to remove if you know what you're doing. And it's very satisfying because they're not cancerous. So you know that the patient is going to be cured after you get this thing out of there. So what we do is we take an approach through the back of the thigh right here. So this is right on the back of the dog's right leg. And we're going to get through the skin and expose the tumor. And then the trick to these is once you get in there and are ready to remove the lipoma, you don't want to use any instruments because the sciatic nerve runs right between these two muscles as well. And so you don't want to accidentally cut that. That would be catastrophic. So what we'll do is once we get in there and expose the tumor and establish a plane between the tumor and the muscles, we'll just use our hands to scoop it out. So right here, it's starting to get exposed. We'll be able to see it a little bit better in a second, but my finger is basically right on top of it, and this is the last little bit of connective tissue that's keeping us from being able to see it.
Hey, Kylie.
So now that the tumor's exposed, I'm just trying to work my fingers around it.
I'm going to show you something cool. So here's this tumor. There's one muscle belly, the other one's hiding up there, and it's just stuck in between them.
And you can see you can slide in there really easily right between the fatty tumor and the muscle bellies.
Finger is right now. See, all sticking, sharp sticking.
And I'm just breaking down the little attachments. There's usually a few blood vessels going to these, but they're not very vascular, so they don't bleed very much. But it's common that you'll break a blood vessel or two as you're getting it out of there. That's not the end of the world, and you just get it out and then find what's bleeding and stop it. Oftentimes, though, by the time you get the whole mass out, the bleeding has already stopped. And these masses can get really large. This one's pretty big. It's coming out in several pieces.
Right?
And we've already gotten one large chunk out. Now here's another one, and it's kind of tethered to something, and I'm trying not to pull on it too forcefully because one of the things, again, that it might be involved in is the sciatic nerve. So here I can see a little blood vessel, and I'm way up outside of the leg, so I know I'm not going to cut the sciatic nerve, so I'm using some cautery to cut those blood vessels and keep it from bleeding too much on me.
I thought we. You only get one what now?
Per suture. Like you have nothing's included. I can confirm with Janae, but
Well, then that was me. Yep, that one was totally me. I thought that it was.
Yeah, because like Dan's, none of his include suture either.
And so now that we've dealt with a little bit of the bleeding, we can keep teasing this mass out. And right here, it's probably hard to see right now, but we'll get a better view of it soon. But my left hand is kind of isolating the sciatic nerve. It is closely associated with this mass. Now, since it's not a cancerous mass, it's not going to eat through the nerve. It's just kind of wrapped up around it. So I'm trying to tease it out without pulling on that nerve too much and making it angry. I'm trying to get the last little remnants off of the sciatic right now.
Good. I think that was a vessel and not what I just called.
Heart rate didn't.
Right, the leg didn't twitch all over the place. So I think that was probably a good sign.
And that is the tumor out. Now I'm going to look in and make sure I don't have any more mass that I've missed.
Okay.
And you can see this bright white structure in here once we get the gauze out. It's running along the length of the incision, kind of deep within the leg, and that'll be the sciatic nerve.
Nice.
We're just trying to take a look for any more bleeding.
It's a big artery. Lipping away. It's a large.
We're pointing at the sciatic nerve right there, that bright white structure just underneath my pointer finger. And it looks like all the bleeding is under control.
So I'm just trying to make sure I don't have an ooze in there. Cool.
Yep, no more bleeding. So now we can close this. And people might be tempted to put a drain in this. It does not need a drain. A drain is just going to make it more prone to become infected. So we're not going to put a drain in. We're just going to close this in a routine fashion, close the subcutaneous tissue, close the skin, and be done. So I'll speed it up right here because the rest is just suturing and a little less exciting to watch. So the big takeaways from this are if you see a large swelling in the leg, and especially if the dog isn't particularly lame, the lymph nodes are all normal, there's a good possibility that it could be one of these intermuscular lipomas. So the way I confirmed the diagnosis on this was initially I looked with an ultrasound and it looked like there was fat deep to the muscle. To confirm, we took an x-ray, and on x-ray you can see a spot between the muscle bellies that is a lot less radio opaque, or it's not as bright on the x-ray, and that's because fat has less density than soft tissue, so there's a good contrast between the two. And so you can see a fat density through the middle of the leg, and the rest of it looks totally normal. So that's very consistent with an intermuscular lipoma. The main potential complications of this surgery would be damaging the sciatic nerve, which, as you can see, if you know how to do these and you know that the nerve is there, that should be very easy to avoid damaging. And then just your standard operative complications such as blood loss. Again, these don't tend to bleed very much, and it's fairly easy to control if there is a little bit of bleeding. And then infection, again, if you're going relatively quickly and this part of the body isn't exposed to the air for a super long time and you're not causing a whole lot of trauma, and the patient doesn't end up licking the incision or something like that, the odds of infection are pretty low. Usually on a surgery like this where I have a large amount of tissue exposed, I'll give antibiotics during the procedure. So those antibiotics are penetrating all of those tissues while we're working, and that should be more than sufficient. So I don't tend to send these patients home with antibiotics. We just send them home with some anti-inflammatory pain medication, and they usually do great. If there is any evidence of infection, of course, we can start antibiotics. The concern would be that if there is an infection, there is a pretty big pocket of space in there and it could develop into a large abscess. I've never had that happen with one of these cases, but I have had it happen with similar large lipoma removals where the patient managed to get the incision dirty and infected, and then it turned into a large abscess in the void where the lipoma had been. So you do want to be pretty sterile with these and really ensure that the patient isn't doing something that's going to induce infection. So as much as I hate having to use the e-collar or the cone on patients, this is one of those cases where it's much better to put up with the frustration of the cone for a week or two than it is to have the incision come open or become infected, or develop any other easily preventable complication. So that is removal of a large intermuscular lipoma in this little dog. Thank you all for watching. If you have any questions, make sure to leave them in the comments below. And also, if you have anything in particular that you want to see, whether it's a surgery or if there's a particular discussion topic that you want me to address, please feel free to leave that in the comments below. Also, my email address is in the bio. If you have any need to get a hold of me, please feel free to reach out to me via email. It's dr.wardwell@icloud.com. Thank you all for watching. Have a great day.